right, everyone. Thank you again for joining us this afternoon. I really appreciate knowing how important this is and how busy you all are that you're coming here today to get the word out. And as you know, today we're at our COVID-19 vaccine site here at the Oviedo Mall, and we're encouraged to share some of the news regarding the community dispensing of the vaccine. In our first week, we were able to deliver 7,635 vaccines to eligible individuals. We, as you know, were the first county in Florida to openly give public accessibility by appointment for vaccines for those 65 years and older. And we're happy to share that the state has now expanded the criteria for county distribution to also include non-hospital healthcare workers. Governor DeSantis at the Orlando Health in Longwood today, the South Seminole branch, earlier shared information regarding vaccine availability to frontline healthcare workers at our hospitals. They will be opening up their testing facilities, which they have 6, including the closest one to us, the Convention Center in Orange County, to also be eligible to provide the vaccine. And tomorrow, we're also grateful for the We're also grateful to the workers of the state officials to ensure that our vulnerable populations are safeguarded from COVID-19 as soon as possible. Today, we're going to hear from the Seminole County Department of Health, Donna Walsh, with more on COVID in our community. Also, Dr. Walt Griffin of the Seminole County Schools concerning return of students to classes. But first, I'd like to introduce Alan Harris, our Seminole County Emergency Manager, to share more information about the dispensing in our county. And ladies and gentlemen, just one other note. Remember, this is the first press conference we've had after the holidays. You know that we have fulfilled all of our appointments through January 9th. However, because of the holidays, we all knew it was happening. We have had a severe bump in cases, both in our hospitals and our ACLF, as well as just cases themselves, more than 10% just today. So we all understood that this was happening, but we also know that we are here to provide the service that is so desperately needed to the citizens of Seminole County and all of Florida. And with that, Alan Harris.
Thank you, Chairman. Today we have seen an increase of COVID-19 at an alarming rate. We knew this could occur, of course, during the holiday season, and unfortunately it has. As the Chairman mentioned, we have seen a 10% increase just over the weekend. And just when I left the Emergency Operations Center a few moments ago, 10 additional people have already been entered into our hospital system. So we are now at over 120 individuals in the hospital systems here in Seminole County with COVID. That does not include Seminole County residents that have gone to Orange County to get treatment. We currently are at over 2,300 active COVID cases in the county at this time. So while there is good news that the vaccine is here, we also need to encourage people to remain vigilant during these times. Facial coverings and masks. If you're sick, stay home. Social distancing, all these things that we've echoed over and over again, they can prevent the spread of the virus, and we hope that people will do so. Months ago, the director of the Florida Department of Health, Donna Walsh, and I met, and we had discussions about vaccine hesitancy, that people may read the conspiracy theories that are on the websites and be reluctant to receive the vaccine. I'm very proud, very happy to report that is not the case as what we're finding. In fact, there's quite a demand, a very large demand So much of a demand that it crashed a website and overloaded a telephone system. When we launched this program, we knew that there would be some errors, and there were some errors, and we fixed those errors. We do appreciate everybody's patience while we did the COVID rollout. Everybody was relatively pleasant, understanding the demand of local government and private hospitals as we started the delivery of the vaccine program. We have learned, and from that we have learned some social distancing issues. We've doubled the size and then actually quadrupled the size of the COVID-19 pod location. So the facility that you're in today, we believed initially that we could put enough people through here and social distance, and it was very clear after the first day, and that's why we did a soft opening, that we would need to double and triple the size, and we have done so. We're actually now even looking at a larger area where we can keep people out of the elements, keep them warm. It's cold outside today. Do a nice reservation system, have them come in, come out, that it be easy and quick and efficient and comfortable. We increased our website capacity by increasing servers, and we also increased our call center staffing so that now we can handle a much larger number of interest in the vaccine. So again, very, very happy that people disregarded those conspiracy theories, and actually there was a demand for our most vulnerable populations to get the vaccine. We are anticipating receiving additional vaccine this week, and as we receive the additional vaccine this week, we will open up more reservations, so more tickets will be available for individuals to make appointments. The text number that to get on this wait list is COVID-19-INFO, COVID-19-INFO. If you text that word, one word, to 888-777, you will be sent a text alert when that reservation system becomes available. You can also go to our website at prepareseminole.org, to find when reservations come available. Reservations do get canceled. People have to cancel it for whatever reason. They have to go on a trip, whatever the reason may be. They do, every once in a while, they will cancel reservations. As those tickets come available, you can book those also online. So you can check periodically throughout the day to see if there are any cancellations, and of course you can book those as well. Last week, we increased the size. There was a social distancing. There was masks required here in the vaccine clinic, and everything relatively flowed well. We were able to increase our throughput. We were seeing it on an average about 800 individuals at this one site. We're expecting to increase to provide over 900 vaccines next week. Oh, I'm sorry, this week. So 800 last week, 900 this week. We will begin mobile delivery of COVID-19 to specific targeted communities. Now, we talked about this before we started to do the vaccine rollout, that we would go into transportation disadvantaged communities, senior living, 55-plus communities, etc. So we will begin that starting tomorrow. We will be doing direct delivery to transportation disadvantaged communities, low-income communities, as well as senior 55-plus communities. And we're going to continue that operation as long as vaccine doses continue to be funneled here to the county so that we can continue those services. Of course, with all this, with the vaccines and everything, we are still providing assistance to those with COVID. So we're still providing food services to those that are stuck in their home, isolated in quarantine, and may have no means to get food to their home. We're still providing PPE to those that need personal protective equipment inside of their home to protect their family members, to protect other folks. So we're still providing those services. And of course, we're still providing testing. We've increased our testing this week and this month to Monday, Wednesday, and Friday. We'd have evening test sites as well as daytime test sites. So you can go online, again, to our website, prepareseminole.org, to find a test site. Or if you need information more about testing or vaccines, if you don't have a computer, you're not really computer savvy, that's fine. You can call our Citizens Hotline. Again, we've increased the number of individuals on that Citizens Hotline to handle the bandwidth and the demand. 407-665-0000, 407-665-0000. That is open Monday through Friday from 8 to 5. And with that, I'd like to turn it over to Donna Walsh. Just done an incredible job putting all this together. Donna Walsh with the Florida Department of Health, Seminole County. Donna?
Thank you so much, Alan. And, I often, and thank you, Chairman, I often mention to my colleagues across the state that we have incredible partnerships here in Seminole County. We are very grateful for that. We're very blessed here. None of us could do this alone. And I'll mention some of those partners today that have really stepped up to help us. Before I talk about the vaccine events and our planning, I do want to go over, as the Chairman and Alan mentioned, that we've definitely seen a significant increase in the number of positive cases, not only here in Seminole County, but also in the state of Florida with the holidays. And it's unfortunately was expected as people gather together. And, we do completely understand COVID fatigue, people wanting to get together with family and friends, but we cannot stress collectively enough the importance of continuing to be vigilant. We're not through this yet. There's definitely that glimmer of hope out there with the arrival of vaccine. But even those of us who have been vaccinated are still wearing protective measures. The vaccine may take upwards of 10 to 14 days to become effective. After the first dose, it takes your body about that long in order to develop adequate antibody response to protect you if you were exposed. And that's only about 80 to 85% protection from the Pfizer Moderna vaccines. After the second dose, then you're up to about 95% protection. So we're stressing that we all continue to wear the protective, or practice the protective measures of wearing a face covering, washing your hands, and social distancing. So in Florida, there's, as of 24 hours ago, a report of 1,365,436 positive cases since the COVID response began back in February, March of this year, with 21,987 deaths in the state of Florida. Here in Seminole County, we have seen total 18,726 confirmed cases now, with 2,321 active cases. That's significant. I would describe what we're seeing today as exponential growth. In fact, our number of total cases the month of December, 4,659, surpassed what we saw in our last surge or peak in July by 614 cases. So we're definitely higher than we were in July when we had that really steep climb in cases. We unfortunately have reported here in Seminole 316 deaths, a total of 917 hospitalizations, with currently 114 hospitalized due to COVID-19. Our positivity rate, daily positivity rate, has also increased, just as it has throughout the state. The holidays have made it a bit more challenging to determine the positivity rate because testing has gone down. So when that denominator, that number of people tested, goes down, that can make your positivity rate go higher. But our previous day is 16.37%. We haven't seen that high since, like I said, our previous peak back in July. So as Alan and Chairman mentioned, we are continuing, even though vaccine events are occurring, we're continuing our testing efforts throughout the community. Everything that we've been doing throughout this response will remain in place because all of those elements are important as we fight this fight against COVID-19. As mentioned many times before, our most vulnerable population are those who are 65 plus. That's hence why that is a priority group as we're starting vaccine. Also our healthcare workers, our hospital workers, those folks who provide frontline services, long-term care facilities, nursing homes. Walgreens and CVS has a federal agreement to go into our nursing homes, long-term care facilities to provide the vaccine. But as mentioned previously, our county stands ready to go in and support that effort in the event that they need that support and help. So in Seminole County, thus far, if you look at the number of cases reported for, like I said, the month, significantly higher this last week, December 27th through January 2nd, 1,363 cases reported just in that 1 week. Go back a month ago, it was 800 cases. So as mentioned, significant growth there. In vaccines, as the chairman and Alan already mentioned, in the state of Florida, just with the deployment of vaccines, less than 2 weeks, over 255,000 people have been vaccinated. Here in Seminole County, 7,635, of which 3,225 have been right here at the Oviedo Mall. So we're looking to expand those efforts as more vaccine comes to us. We've also, as Alan mentioned, we do fully understand that not everybody is capable or able to come out to these events. So we have a mobile team that's going out to people's homes who medically, physically can't get here. They might be transportation challenged, whatever the case might be. So we have, to date, gone to 70 people's homes. We have vaccinated 70 at their sites due to, challenges with getting to the pods here, the vaccine pods. And we will continue those efforts through working through the county and the Citizens Information Line. Folks can call in if they're unable to make it to one of these events. And we basically screen and see if they qualify for mobile services. There is no fee, absolutely free of charge. This is supported by Seminole County government. So we will be going out to help those individuals. The community partners that have come together, I was just speaking to Dr. Walt Griffin, our superintendent, Seminole County Public Schools, and he'll be coming up just after me to talk to you all, but his nurses have been phenomenal, coming out to help us during the holidays to vaccinate and also do data entry, and so they've been great, as well as, of course, Seminole County Government Emergency Management. All of this wouldn't have been possible without Alan and his team. Allied Health has been with us through testing from the very beginning, and they have now been able to provide support in vaccination and data entry. Also, our county and city paramedics and EMTs, they've been amazing. They have come out each and every day to support us, and they will be going out to the community events that Alan mentioned with our 55-plus communities and elsewhere where we know that folks are unable to get in to this particular site. Also, the American Muslim Clinic, Social Services, they have offered to help us as well. It's interesting, as people have come through to get their vaccine, 65 years of age and older, many have asked, how can I volunteer? How can I help you? These are retired nurses. These are people who aren't even in the medical field, so thank you for that. And we have taken down names, and we'll be following up with those individuals and recruiting them very quickly because we want to be able to deploy as many teams as possible out in the community and provide the vaccine safely and as soon as we possibly can. So also been working very closely with Physician Society of Central Florida. They have gotten the word out to the healthcare providers about the event we have scheduled on the 11th, next Monday, for healthcare providers. And as Alan mentioned, once the appointments are reopened, it'll be this week sometime when the appointments are reopened, then healthcare workers as well as those 65 years and older can register for their vaccines starting next week forward. So we will continue to request more vaccines from the Florida Department of Emergency Management and Florida Department of Health as we get close to giving out all the vaccines that were provided. We continue to ask for more, and so far, they've been able to send us what we need. So our hopes are that we don't run out, that we're not, in a position where we have to suspend vaccinations. Alan and I are staying ahead of it, so that we will continue to get a supply coming in. So with that, I'd like to introduce our Seminole County Public Schools Superintendent, Mr. Walt Griffin. Thank you.
Thank you, Donna. Good afternoon, everybody, and Happy New Year. Today is the first day of school in Seminole County. Today we welcome back over 7,600 additional students whose families decided to send them back to school face-to-face. They had been students who were either in Seminole County Virtual or Seminole Connect. We began this process in early November to let parents start making choices, and parents started making choices in early November. Some changed their mind in December. They look at the stats, and we're trying to keep these choices open because we know that these are very personal and important decisions to families. Of course, for us, every time we move a group of students from virtual learning to face-to-face, we have to transfer teachers, whether we're transferring teachers from our virtual school or from Seminole Connect. So our school principals, our school leaders have just done a phenomenal phenomenal job with an ongoing scheduling process this entire school year to meet the needs of our community. So right now we have about 40,000 of our 65,000 students back face-to-face. Our same safety protocols from first semester remain in place. Students and all employees, everybody in our buildings will be wearing a mask. The importance of hand washing and social distancing, and we, of course, are maintaining our rigorous cleaning schedules throughout our schools. Quarantine, the amount of time has been reduced from 14 days to 10 days per the CDC and the Florida Health Department. Parents, if you're looking for bus schedules, you need bus information, please remember, just go to our website, www.scps.us, and look for the link under bus transportation. Also, a great coup for our community, free meals are available for SCPS students 18 and under, and that has been extended through the rest of this school year, and that includes both breakfast and lunch. Reminder, if your child is sick or was in contact with anyone that's tested positive for COVID-19, please keep them home until they've been cleared, and let your school administrators know so they can be aware and provide opportunities educationally for your children. Thank you for your time today, and I'd like to turn it back now to our county chair, Lee Constantine.
Thank you, Walt. A couple of last things that I want to say. If you have any questions, we do have folks here, as you know, that will be happy to answer them. The sobering message is that, if you notice today, 350,000 of our fellow Americans are now gone because of this. Just a horrible number, horrible number. This facility here today is doing 800 a day last week, and we expect to be able to do 900 today, or 900 from now on, starting tomorrow. Again, the text is COVID-19 info, and you text that to 888-777, and you will be notified when the appointment lists will be coming up. That's not a wait list. We wanted to make sure that you knew that it was a notification of when the appointments would be started again. The hotline, if anybody has any problems, and I know that some people have had some concerns over the hotline or how to get on, again, it's 407-665-0000, 407-665-0000. Tomorrow, as was stated, we are starting mobile delivery to the transportation disadvantaged communities and to some communities, the over 55 communities, and we are looking at other sites throughout Seminole County that we can deliver the vaccine just like we're doing here at the Oviedo Mall. But again, we have to have the vaccine first, and the vaccine is on the way. And when we open it up for appointments again, it will be again after January 9th. Keep that date in mind because we are booked through January 9th. Are there any questions for myself, for Mr. Harris, Ms. Walsh, or Mr. Griffin, Dr. Griffin?
You have a COVID-19 to text to 888-777. Is that different? Is people can text COVID-19 or COVID-19 info?
COVID-19 info.
So it changed?
Not that I'm aware of, no. No. COVID-19 info to 888-7777. Yes, sir. Yes.
Yes, sir.
So how many additional doses are you expecting to get in this next round?
Roughly a little over 12,000. It's on an Excel spreadsheet, so we just need to make sure that it gets here to verify everything. We don't want to make a reservation, obviously, for a dose that we don't have, so that's why we're hoping to open it tomorrow once it's received. Again, I'm not exactly sure when it'll get here, but we expect it today or tomorrow.
Will this be the Pfizer or the Moderna?
This one is supposed to be Pfizer, yes. So Again, we get preliminary information until it actually arrives, and this has been pretty much throughout the pandemic. We sometimes are told PPE is arriving and we're going to get 4 pallets of something, and we end up with 3 pallets. So before we open something up and raise a lot of hopes, we want to make sure we have everything in hand.
But your understanding is you got 12,000 doses allocated that they could arrive as early as tomorrow.
As early as today.
Okay, but until you physically have them
Right.
delivered, you're not going to reopen any kind of appointment for them.
Right. We don't want to. We want to make sure they're here. They're good. They're the vials are all intact. Everything is set before we open anything up.
I have a question for Dr. Griffin,
Okay.
if you don't mind. Hi, Laura with WKMG News 6. Earlier today, Governor DeSantis said that he's looking at the possibility of having teachers in the workforce as a part of that second group to receive the vaccine. Would you like to see teachers prioritized for vaccine distribution, and if so, why?
Yeah, I absolutely would. Actually, the professional association I belong to, we sent a letter to the governor prior to the holidays requesting just that. Our teachers are frontline workers, yet we understand and completely respect that healthcare and medical are the first tier and essential, but we have many teachers who would love to be vaccinated and would like that opportunity, and they are out there with our children every single day.
And then the other thing that he had mentioned, too, was the possibility of having schools distribute the vaccine in the schools. Logistically, is that possible?
It is possible, especially if we were just vaccinating adults on a voluntary basis. It is possible. Remember, we did flu shots many years for adults and for children, so we have the infrastructure to do that. As Donna Walt mentioned, right now many of our nurses are tied up helping with this priority, so it's just a matter of having enough hands on deck to get everything accomplished.
And then my final question, have you seen teachers express a desire to be vaccinated?
Absolutely. I've been contacted personally by teachers just asking to please help so we can get vaccinated. They want to be back at work, they want to be face-to-face, but they want to feel safe.
Another question for you, Stephen of Boston side. Is there a concern of an increase of cases in the school, as students return and more students return from the winter break? And then how do you adjust the classroom sizes and other things within the school to make sure there's still that social distancing?
Yeah, we had lots of practice first semester, and really it's case by case, school by school. We encourage our families and our employees to practice social distancing at home. A lot of times what happens, I think we put our guard down over the weekend, and then students come back or adults come back, and they've been in contact with somebody positive, and we have to quarantine more. So it's really just keeping those basic mask wearing, hand cleaning, social distancing in place. And then we deal with every single case that we have to at school. We use surgical contact tracing. So we look at really who has been in contact with somebody who's been quarantined and quarantine an entire group.
And do you expect that there might be an increase in cases just seeing what's going on in the state?
Absolutely. We saw an increase after the 3-day weekends. We saw a little increase after Thanksgiving. I would imagine that we'll see an increase after the holidays. We're prepared for it and trained for it.
Are there any other questions? If not, again, thank you very much. The one thing that we all want to bring out today is hope is on the way, help is on the way, and Seminole County is ready, willing, and able to do whatever we can to provide this vaccine. Myrna Chamorro will now do an update from the translation from Spanish. Myrna, come on. Thank you very much again for all your... Thank you, everyone.
This is Myrna Chamorro, y voy a estar haciendo esta es Myrna, y estoy haciendo el resumen de la conferencia de prensa. Primeramente habló el presidente de la Junta de Comisionados del Condado, Lee Constantin. Él le dio las gracias a los medios de comunicación por unirse para compartir nuestro mensaje. Hoy estamos en nuestro sitio de vacunas COVID-19 en el Centro Comercial Oviedo Mall y nos animamos a compartir algunas noticias sobre la dispensación comunitaria de la vacuna. Fuimos el primer condado en Florida en abrir un sitio de vacunas de acceso público con cita previa para personas mayores de 65 años de edad. Nos complace compartir que el Estado ha ampliado los criterios para la distribución del condado para incluir también a los trabajadores de la salud no hospitalarios. El gobernador Ron DeSantis estuvo en Orlando Health South Seminole hoy compartiendo la información sobre la disponibilidad de vacuna a los trabajadores de la salud en nuestros hospitales. Agradecemos el trabajo de los funcionarios estatales para garantizar que nuestras poblaciones vulnerables estén protegidas del COVID-19 lo antes posible. Luego habló el director de manejo de emergencias del condado, Alan Harris. Él mencionó que ha habido un aumento, un 10% aumento de casos en el fin de semana y hay sobre 2.320 casos activos en el condado, que es muy importante mantener la vigilancia y seguir practicando el distanciamiento social, el uso de máscaras y el lavado de manos, pues para evitar el contagio. Se está buscando ampliar las citas para personas mayores de 65 años de edad, así como para los trabajadores de atención médica no hospitalario, tan pronto se tenga más confirmación de la fecha de llegada de un próximo cargamento de la vacuna de COVID. Ha habido mucha preocupación también por la vacuna al principio. Muchas personas estaban quizás un poco reacias para adquirir la vacuna, pero él está muy contento de informar de que muchas personas ahora sí quieren la vacuna y se han sobrepasado, se ha excedido lo que se esperaba en cuanto a la vacunación. Si usted desea saber, porque se está trabajando en un lugar más amplio para dar la vacuna, se va a aumentar de 800 que se estaban dando la semana pasada a 900 dosis cada día. Si usted quiere conocer la disponibilidad de las nuevas citas, porque las citas cierran muy rápidamente, texte COVID-19 Info, toda una palabra, COVID-19 Info, al 888-777. Y si quiere saber dónde podría reservar sus citas, también puede visitar prepareseminole.org. El condado va a estar ayudando también en cuanto a dar las vacunas en los centros de cuidado para adultos, así como CVS y Walgreens lo están haciendo, y mañana comenzarán a visitar algunos de estos lugares. Se dispensarán también en los pads cerrados dentro de comunidades de jubilación y comunidades que no tienen transportación, comunidades donde viven personas de 55 años de edad o mayores. También el condado continúa ayudando a aquellas personas que han sido diagnosticadas con COVID y le proveen alimentos y otros servicios de ayuda. Se sigue también haciendo las pruebas a través del condado y están disponibles lunes, miércoles y viernes de esta semana. Puede visitar también prepareseminole.org para registrarse para realizarse la prueba. La directora del Departamento de Salud, Donna Walsh, también habló y mencionó que en la Florida, pues sí, como mencionó, ha habido un aumento significativo de casos y que permanezcan vigilantes y tomando las medidas como el uso de máscaras, nuevamente repetimos, el lavado de manos y el distanciamiento social. La Florida tiene un total de 1.365.436 casos positivos y 21.987 muertes. En el condado Seminole, hasta el momento hay 18.726 casos confirmados, 317 muertes. Hay una tasa de positividad de 16.37%, o sea que hemos visto que ha aumentado muchísimo. En el mes de diciembre hubo 4.659 casos, que esto sobrepasó el mes de julio por 614 casos. Así que vemos que ha estado en aumento, que esta es la segunda ola en diciembre, así como la vimos en julio. En noviembre hubo 2.593 casos, o sea que se ha duplicado, se ha seguido aumentando. En cuanto a la vacunación, al momento en la Florida 255.808 personas se han vacunado con la primera dosis. En el condado Seminole 7.635 personas también han recibido la primera dosis. Queremos expandir esto, o sea que queremos que más personas se puedan vacunar y seguimos pidiendo más vacunas al Estado para que así las envíen y poder abrir más oportunidades para la comunidad. La unidad móvil del Departamento de Salud también provee las vacunas en los hogares a aquellas personas que no pueden ir hasta los eventos y al momento se han vacunado 70 personas, se han visitado en sus hogares. Agradecemos enormemente a todas las agencias comunitarias que han ayudado en la implementación del plan de vacunación de COVID, gracias al manejo de emergencias del condado, Allied Health, los paramédicos del condado y de la ciudad, enfermeras del distrito escolar del Departamento de Salud y también el personal de Oviedo Mall que han ayudado a que esto sea una realidad. Seguimos solicitando más vacunas en nuestro condado, así que no pierda la esperanza, y también estamos trabajando con las sociedades de médicos de la Florida Central para asegurarnos que la información llegue a todos los médicos del área. El director el superintendente de las escuelas, el doctor Walt Griffin, habló también y mencionó que al momento, este semestre regresaron a la escuela 7.600 estudiantes, o sea que al momento hay 40.000 estudiantes de los 60.000 asistiendo a las escuelas. Comenzaron este proceso de prepararse desde el mes de noviembre y todavía continúan trabajando con las familias y con los padres. Siguen también siguiendo los protocolos de seguridad. Se mantienen el uso de máscara, el distanciamiento social, la limpieza, y también se reducirá la cuarentena de 14 a 10 días, según las recomendaciones del CDC y del Departamento de Salud. Aquellas personas que desean saber las rutas de los autobuses escolares pueden visitar www.scps.us. También se está extendiendo la disponibilidad de alimentos gratis para estudiantes del condado Seminole hasta el fin de año, y esto incluye desayunos y almuerzos. Y recuerde que si un estudiante, un niño, está enfermo o ha estado en contacto con alguien que ha estado positivo para el COVID, por favor manténganlo en su hogar, que no regrese a la escuela hasta que esté mejor, hasta que sea dado de alta, y que le avise a la administración de la escuela. Muchísimas gracias, esta ha sido la información de hoy.